As we're dealing with reptiles, we want to make sure they are in their preferred temperature zone so they can metabolize, they can absorb the medications, and they can also recover faster. So part of the treatment is to reduce the prolapse, or as Dr. Pardo said, shove it back in. But for that to be done, we need to make sure that the tissue is viable. So there is no necrosis, the tissue is not devitalized, and we can actually place it back inside of the body. In most cases, this can be facilitated or should be facilitated with heavy sedation or general anesthesia. Intrathecal anesthesia might be helpful in chelonians using lidocaine because it will likely anesthetize the pelvic limbs and of course the cloaca. So it will cause it to be very relaxed and it's going to make our job way easier. Now, in order to reduce the swelling in that tissue, we can use cold compresses, hypertonic solutions like 50% dextrose or 7.5% sodium chloride. Those solutions will help reduce the edema of that tissue before utilizing lubrication and gentle pressure to actually place it back. Now, when using cold compresses or even cold fluids, just make sure you're not putting ice directly into the tissue as this can cause lesions as well. So now that we have reduced the swelling, we can lubricate that tissue very well, and then we can reduce the tissue or place the tissue back in the cloaca using either delicate digital palpation, cotton tip applications. And again, the whole goal is to replace the tissue inside of the cloaca again. However, if we had a prolapse of the colon or the rectum or even the oviduct, by just replacing this tissue back in the cloaca, it's not really placing back where it came from, right?